Welcome back to Fox 43 AM Live. Join us now is Michelle Ponce with the Association of Community Mental Health Centers of Kansas. Good morning.
Good morning. Thank you for having me.
No, thank you for joining us today. So we're here to talk about mental health. And I understand our public mental health kind of system has been largely unchanged since the 1990s. So tell us kind of what's going on with the state's safety net.
Sure. So our association represents all 26 community mental health centers across the state. They serve all areas of the state, 24 hours a day, 7 days a week. And as you said, the system has largely remained unchanged since the early 90s when they kind of shifted care from institutional settings to those community-based settings. In the last couple of years now, we are experiencing what many have called the biggest transformation since mental health reform. And really what we are seeing is a movement to what they refer to as the Certified Behavioral Health Clinic model, or CCBHC. There's no way I'm going to be able to keep saying that over and over. And the difference is really that it's the shift towards whole person integrated care.
Okay.
So as you seek services, if you or someone you know has a need for mental health or behavioral health services, when you walk through those doors, what they're really going to be focusing in is all aspects that you might need to stay well and to stay healthy. You know, there's a connection between behavioral health and physical health and all of your social needs. And as a CCBHC, they're going to be looking to provide all of those services to keep you healthy and to keep you in your community.
It's wonderful that, you know, we're changing and adapting. And so I'm curious, with this kind of the old system that we're integrating away from, what have been the challenges over the years that we're seeing being addressed now with the CCBHCs?
Sure. And so this is a national model that is really predicated on trying to address workforce shortages, rising rates of suicide, both nationally and within our state as well, and rising rates of mental health issues like anxiety and depression. I think what we've seen now, especially as we're coming out of a national pandemic, we're seeing those needs have significantly increased. And so moving to this new model of care provides more stability for the providers that allows for them to better recruit and retain staff that are so desperately needed. And then it really expands the service array. There's a real focus on prevention, training, and in crisis services. So those are some of the things that communities can expect to see as this change continues.
That's wonderful. I love to hear that. And so now the 44th annual conference for behavioral health is coming up on Wednesday. What does this mean for the state and the community?
Yes, our association, we're so excited. It's our busiest but most exciting week of the year. It's really the largest annual gathering of behavioral health professionals in the state of Kansas. We anticipate over 500 attendees coming here to Topeka. You know, our focus as an association and as a state is really on innovation, becoming and providing high opportunities for learning and training for behavioral health professionals. So we provide those opportunities throughout the year, but at our annual conference we have a huge focus on introducing them to innovative new strategies, networking, and kind of building that capacity. And of course this year there will be a focus on the CCBHC transformation. 20 of our 26 mental health centers have already become CCBHCs, and the next 6 are anticipated to do so in the next 6 months or so. So a big focus on what all those changes mean, including really a focus on increasing access. As centers become CCBHCs, they will be striving for open access, meaning if you need assistance and you walk through those doors, you can get that on the same day, and really making sure that people receive timely services.
That's I cannot wait for all that just a better upgraded health center community like that. That's going to be great. Is there like a timeline that people can expect to kind of start seeing some of these changes roll out more?
Sure. In many areas of the state, these changes are already in the works or have already been implemented. Nearly the entire state is covered now with mobile crisis response, meaning if you or a loved one is experiencing a crisis in the community, they will come to you. But the whole state will be covered by CCBHCs by July of next year.
Wonderful. It's going to a brighter future is on the horizon.
It's really exciting.
That's great. And so, real quick, if somebody is in need of services right now, what's the best way for them to reach out to somebody? What number can they call, or where can they go to kind of learn a little bit more about their next step of what they want to do?
Sure. Well, you can absolutely contact your local community mental health center, or CCBHC. We have an interactive directory on our website at acmhck.org, and you can find the local addresses and phone numbers. But of course, if you or someone is experiencing a mental health crisis, you can call 988. It's the National Suicide and Mental Health Crisis hotline. And here in Kansas, we have 4 hotline centers that are answering those calls, and they are able to work with the individual and try to de-escalate the situation, and if needed, deploy those mobile crisis responders.
Wonderful. All right, Michelle, thank you so much for joining us today. This has been a pleasure. It's been great talking to you this morning.
Thank you.